So every year at our Oration, we launch our annual review, which showcases some of the great work undertaken by our staff during the past 12 months and as part of our role as a National Treatment Research and Training Centre. However, before we officially launch our review, I just want to take a few minutes to highlight some of those activities that you've seen already in the document that you've had on your seats. I'm delighted to announce that it's been a tremendous year for Turning Point and our collaborators. Our clinical services in Fitzroy and across the Eastern region provided treatment to over 3,000 individual clients, while our state and national telephone and online services provided support to over 120,000 people across Australia. For those who aren't aware, we run over 20 helplines for alcohol and drugs and gambling across the country, and we're at the forefront 24/7 when someone is in crisis and wants to know where they can go for help. Our workforce development team delivered courses to more than 1,200 students, many of whom completed nationally accredited courses, either at certificate 4 or postgraduate level. And we also enrolled record numbers into our master's program, which we run in partnership with Monash University. Our research teams completed over 60 major projects, many of which were not only relevant to Victoria, but also nationally and internationally. We could not have achieved this tremendous outcome without the strong support of our many collaborators in Australia and overseas, many of whom are in the audience today, and I would like to take this opportunity to thank them formally. The translational nature of our work means that it's critical that we get information out to the community as rapidly as possible. Turning Point continues to be the go-to organisation for Australia's media, with over 1,200 media mentions in the past year and coverage across all major media outlets. Whether it's Dr. Matthew Fry, our clinical director, giving his expert opinions on the dangers of prescription drug use on Channel 10's The Project, Associate Professor Belinda Lloyd discussing the high rates of mental health presentations to ambulances with the Herald Sun, or myself recently on ABC's Four Corners talking about private rehabs. Turning Point can be relied upon for providing considered and evidence-based commentary on complex issues to a diverse range of audiences. We don't have the time to highlight all the great work of our staff, but a few are worth a special mention. So working with our partners, Shark and the Bouverie Centre, we've just completed the first year of a 4-year programme of work to provide family drug education in relation to ice use. Funded through the Victoria's ICE Action Plan, our Breakthrough programme has delivered over 40 workshops across Victoria to over 1,300 family members. This has been an outstanding achievement and a great opportunity for the 3 statewide services to work collaboratively to reduce the harms associated with ice use in our community and to support families to connect and receive the help that they need. The response and appreciation of families has been absolutely tremendous. We're now into the 3rd year of our delivery of our Masters of Addictive programme. This is Turning Point developed course in partnership with Monash. It's fully online and interactive. And, in addition to our own academic staff, incorporates the teaching of the who's who on addiction. Notable contributors include senior academics from Victoria, such as Margaret Hamilton, David Pennington, Robin Room, all our symposium speakers here today, interstate academics such as Steve Olsop, Nick Lingzaris, David Kavanagh, as well as overseas academics such as Jim Orford and John Grant and others. We've seen student increases year on year since commencement and now have 24 students across Australia. We're also pleased to see 3 students graduate this year and interest levels remain high, and we anticipate further growth in student numbers in the coming years, and we're looking at how we can streamline processes to make it more inclusive for all. We just completed the first year of a 3-year study funded by the Movember Foundation Beyond Blue. This has involved coding male mental health and alcohol and drug presentations to ambulance services nationwide. That's 500,000 records each year, as well as conducting a national survey of paramedics about the skills, confidence and attitudes to working with men presenting with mental health and alcohol and drug issues. Working with our university colleagues and ambulance services across Australia, we're developing a targeted training program for paramedics that will enhance their confidence and skills in supporting men with these issues, as well as trialling a range of low-cost interventions that promote help seeking and access to effective treatment. Turning Point just recently completed a 3-year study in collaboration with Monash University and Deakin University that explores gambling rates and harm among individuals seeking treatment from a range of mental health services in Victoria. Funded by the Victorian Responsible Gambling Foundation, this multi-phase project examines how public and private mental health services respond to problem gambling and how well they have trained their staff on this issue. Initial results indicate that while mental health clients are less likely to gamble than the general population, when they do gamble, they are much more likely to experience gambling harm. We are using this research to inform evidence-based responses in the area, and this report will shortly be released. Finally, Turning Point has been a major leading provider of online services for people affected by alcohol, drugs, and problem gambling. For the past 10 years, people have struggled to access services because of geographic isolation, mobility, stigma, or privacy concerns have turned to our online services for support. Two services that we provide are Counselling Line, a national online support service for people concerned about alcohol and drugs, and Gambling Help Online, the equivalent service for problem gamblers. During the past 12 months, we've responded to more than 8,000 requests for ongoing counselling. We received over 200,000 visits, which marks a 20% increase from the previous year. Next week, the Commonwealth Government will be formally relaunching a refreshed Counselling Online with enhanced online support tools to be even more user-friendly on mobile devices. The site will also include peer forums, which we've found to be an incredibly important component of our online services, with our Gambling Help Online forum growing over the last 3 years to 3,500 members, with over 10,000 posts last year alone. So, obviously, I can't talk about all our achievements, but I think you can agree it's an impressive array of achievements. And myself and Barb would just like to take this opportunity to publicly thank not just the 20 staff who are in this photo, but all our 200 plus staff for the hard work and dedication of the past 12 months. And also to our collaborators and colleagues for helping to improve the lives of those affected by alcohol, drugs and gambling. Can we just take a moment just to thank them formally? I'd just like to take this opportunity to invite Ben Kelly, our Executive Director, to come and formally launch our 2016 report, Turning Point 2016. Please welcome Ben.
Well, thank you, Dan, and it's a great delight for me to come along to the 2016 symposium and oration. Having been heavily involved in the coming together of Eastern Health and Turning Point in 2009, it never ceases to amaze me the enthusiasm and the passion that comes from the Turning Point staff. And I can tell you personally that Eastern Health and I are extremely proud of the work that Turning Point does. Eastern Health has a real jewel in its crown in Turning Point, and that's not lost on us. Plenty of opportunities remain for us, but in reading through the 2016 report, it becomes clear all of the work, the quality, the quantity of the work that occurs day in, day out. And in the future, and I met with Barb and Dan just this morning, there's many, many more opportunities that we'll explore together and make sure that Turning Point continues to lead the sector in how we deliver services to those who are most in need. Turning Point's growth, really a testament to its success, both generating the ideas about a new service type or research, whether it be treatment services, whether it be training, whether it be research, its capacity to secure funding. Eastern Health sets Turning Point some really, really big goals, and we have lots of discussion and debate about those goals, but Turning Point delivers year in, year out. The report, it captures the flavour of the work undertaken across the whole organisation. I'd like to formally congratulate Barb and Dan on this work and commend the 2016 Turning Point report to you. Thanks, everyone.